Hi, we're here again today with Dr. Megha Hazuria Gore to discuss the topic of counseling. So, ma'am, what exactly is counseling?
Counseling is working with individuals to help them or support them, guide them through emotional, social, behavioral difficulties that they may be facing in life.
And since we've been discussing about the mental health of the youth, so for example, what is counseling for children in school?
So when we look at mental health and school mental health in particular, there are a variety of emotional, social, behavioral difficulties, challenges, struggles that school children today face of all age groups, right from your little ones, 4 years old to your 17, 16, 17-year olds. A lot of times we feel that adults face more emotional concerns or mental health concerns because they're older, they have more problems. But it's surprising sometimes for people to recognize and realize that children face almost all of the same struggles emotionally that adults do. They come out in different ways. The symptoms, the features are different, but their struggle is very real and very much needs to be focused on.
So, generally, when you're looking at these people, the first thing you consider would be their emotional behavior. I mean, for example, if a class teacher is in a classroom and she's scoping out students and generally just making a general assessment, students who have certain emotional behaviors would, for example, be sent for counseling first.
So I think it's important to recognize that counseling is not necessarily always just a separate entity in a school system. I mean, in a lot of ways, teachers are counselors. In a lot of ways, other staff, other community other than the designated school counselor are counseling, because counseling means providing support, right? That initial support can come in from any direction. Every student who goes for help for something, even if it's an academic question or something, is asking for support. If a student is struggling, with a peer, and they need a teacher intervention to help them resolve a conflict with a peer, they are seeking that support. So I think in a lot of ways there is counseling happening all the time in the school system. But yes, there are times when it needs to go beyond this system, and it needs to be referred to the school counselor for maybe more intense, in-depth intervention.
I see.
Where that student may require more one-to-one or a small group intervention.
So basically, a more intense form of support for the student. So so when you're thinking about referring a student, what are the signs and symptoms you consider for people who need a more intense level of support?
Right. So one is the more intense level, and the other is when there is a recognizable mental health concern, which goes beyond what we would call normal difficulties, right?
Okay, wait. So what would happen here is that a lot of students would react due to their social home situations, and then there are the students who have a recognizable. There'd be a distinction between this, right? Children who have a recognizable, say, what would you call this? Issue.
A mental health issue.
A mental health issue, as opposed to students who are coming from, say, a difficult home life or.
So see, what happens is emotional difficulties can be a result of a variety of factors, right? Sometimes it's part of us, biological, right? Passed down generations, sometimes even, like oftentimes depression, anxiety run in families, right? It may or may not come out in childhood, but we see that, right? So sometimes it could be social situations. Peer difficulties can lead to anxiety, low feelings, low self-esteem, right? Home problems, difficult home life, for whatever reason, between parents, parent and child, can again lead to certain symptoms and features in the child, due to which they may be emotionally and behaviorally acting out in the classroom or in the school situation. Now, again, when these symptoms or these behaviors, when do they become a problem? When do they cross that boundary from being a normal reaction to a difficult situation to becoming an illness or to becoming something that is really affecting their functioning in a very detrimental and more permanent sort of a way, right? And that's sort of what we have to look at, and that's where counselors, school counselors, come in to a large degree. So the teacher, to go back to your earlier point, teachers will recognize the initial emotional behavioral reactions. They may or may not be permanent or long lasting, right? But when they recognize them, like a child is too quiet, a child is too naughty, a child is crying for small reasons, a child is having frequent fights with peers, all of which is not typically the child, right? So it is something different from their typical personality, that the change that the teacher is noticing. Then they can either try to intervene at their own level, or sometimes they will refer it to the school counselor to say, look, why don't you go and look into this, right?
Okay.
And then from there the school counselor takes it on to see what is the level, intensity, frequency of that struggle.
The issue required there.
Yes.
So then, I was just curious about this. A lot of students, for example, react to certain situations, so it acts as like a trigger for anxiety or something. So would say the rate of emotional behavior be higher during stressful periods, like before the exams?
Good point.
Or during, say, the annual production or sports day or something like that? Do those act as triggers?
It is possible. Exams especially, I think, we've all seen that exams tend to be a very big trigger for anxiety within children. Their achievement, performance anxiety is very high. So those are times when actually we can be proactive and preventative in a way, where school counselors can have, and often I think they do also have regular sort of talks or sessions with the school community. Teachers talk about study skills, about, so providing students with tools to preempt some of this anxiety and stress.
To keep them prepared for it. At the same time, I actually just thought of one more thing I was curious about. How does social media, the advent of social media, suddenly there's so much information available to everyone on all subjects. I'm pretty sure this affects most students' minds in a pretty significant manner. Does this contribute to emotional issues?
I think both ways. I think social media plays a big role in supporting the well-being of individuals. And I think, yes, it's always two sides of the same coin. Sometimes it may be a stressor also. So I think it's important to look at what we can pull from it in terms of positive tools. I think there are a lot of positive tools that social media provides for students, and one has to kind of,
be able to
take that. Yeah.
Okay, so the next step of this entire procedure would be the role of the counselor. What is a school counselor to do when certain behaviors are brought to their attention?
So, how, we had talked earlier about how teachers are frontliners in where academic and these, difficulties are concerned in identifying, because they are with students so much. I think in a lot of ways, teachers and then the school counselor is a really important person where identifying emotional, mental health issues in students are concerned. So the school counselor, plays a really important role in trying to put together the jigsaw puzzle of the student's life. Family, they can bring in the family, they can bring in peers, they can bring in teachers, they can bring in the individual themselves, and put all that information together to see what and how different things are impacting this child, and what are some resources that are available, what are resources that maybe need to be made available more to the child, what can be provided for them within the school system, what can be supported from the outside, and to really be able to put together everything for that student and their family.
So a lot of the times, a few schools still do this. When a child's emotional levels reach a certain point, they generally, say for example, maybe removed from the class or shifted to, say, open school or something as a reaction to their open. Does this, are there cases where this is actually necessary? Or is this just a way to minimize risk, say, with the main class? What is the payoff over there?
Yeah. No good answer for that, unfortunately. Although I would say that yes, sometimes it is necessary. Sometimes for the well-being of the child themselves, they do require that space, which a school community may not be able to provide them. But again, flip side of the the same coin is that sometimes these are not used in the right way. The services that are available are not used in the right way. They are used as excuses to segregate or to separate out students with needs.
I guess the next step would be when counseling and emotional issues come up. Usually the school counselor may refer someone else.
Right.
So
yeah.
where would you go from the school counselor?
So like I said, the school counselor is a really key person in identifying what is the nature of the problems and what kind of support can be provided. And a lot of times all the support cannot be provided within the school system. The school counselor has limited time, limited resources, certain number of children to provide the services to, and also the school environment within which not all children feel that
like being sent to the counselor's office is a psychological
is not always
pressure
seen
point.
as a supportive thing, right? So in many cases, school doesn't have the resources available to them to provide the necessary support, whether it is in terms of time or whether in terms of the safe environment that the child requires. So in which case they will refer them to psychologists in the community who can take on. In this case also the school counselor plays a very important role in terms of bridging bridging the communication, so they often have, school counselors often have resources in the community, so they may be familiar with certain professionals who are in the community, and so they can provide like a list. Typically schools will provide a list of possible resources in the community, and then the parents take it on from there to take that step and go and approach the professionals.
And what would be the role of a psychiatrist in all of this?
Yes. So again, sometimes the emotional problem or the behavioral mental health issue that the child is facing may be very intense in terms of its biological, physiological reactions, anxiety, depression, more severe illnesses also like schizophrenia even in children we have seen are biological, physiological problems. It is a mental illness, in which case they do require some pharmacological, medical interventions. Psychiatrists are medical professionals who deal with mental health issues. Psychologists do counseling, they can do assessments, but they do not provide medication support. So for the medication support, one has to approach a psychiatrist.
So for a parent, the standard chain would be the class teacher, school counselor, then a psychologist, and then a psychiatrist.
Either or. So the school counselor could actually directly send the child.
Okay, so if it would be an evident issue then.
Psychiatrist, yes.
Alright.
So school counselors are in a position to assess what they feel are certain needs of the child. So a psychiatrist referral can come from there.
Okay, well I guess that covers our topic for today. Thank you.
Great, thank you.